Refractive error occurs when the shape of the eye prevents light from focusing directly on the retina. There are different types of refractive error, which includes myopia, where the eyeball is relatively long, the light rays focus in front of the retina. Hyperopia, where the eyeball is relatively short, light rays focus on behind of the retina. And astigmatism is an imperfection in the curvature of the cornea or the lens. You can think of the normal eye as evenly rounded like a sphere. With astigmatism, the eye is oval-shaped like a rugby. Refractive error can be corrected by glasses, contact lens, and refractive surgery. ICL is a type of refractive surgery. Unlike laser refractive surgeries, which reshape the cornea by removing corneal tissues, it involves the implantation of a thin, biocompatible lens inside the eye to correct refractive error. ICL has a history that spans several decades, and more than 3 million ICLs has been implanted worldwide. ICL can correct up to 18 diopters of myopia, 10 diopters of hyperopia, and 6 diopters of astigmatism. The newest Viva ICL can also correct presbyopia. Surgery can be performed under local anesthesia. A small incision around 3 mm is made on the side of the cornea, and the lens is folded and implanted using an injector. Once inside, it is carefully positioned behind the lens. It takes around 5 to 10 minutes for each eye. Collamer is a highly biocompatible material made from collagen and copolymer. Collamer remains inert within the eye and will not degrade or break down. In addition, it offers protection to the eye from harmful ultraviolet rays. Since the lens is biocompatible with tissues, it can remain inside the eye indefinitely, unless your vision changes. The major difference of ICL when compared to other refractive surgeries such as SMILE or LASIK is the preservation of the corneal tissue, making it a reversible procedure. Since it does not involve removing corneal tissue, patients with thin corneas or treated keratoconus who are unfit for SMILE or LASIK can also consider ICL surgery. ICL can be removed or replaced if necessary, offering flexibility in case of future changes in your prescription or advancements in technology. The ICL gives excellent visual quality because the correction is closer to the nodal point of the eye, and the preservation of the natural corneal tissue may reduce the risk of inducing higher-order aberrations. Moreover, ICL gives better night vision and less visual disturbances such as halos and glares. Since the lens does not affect corneal nerve fibers, therefore it does not cause dry eye symptoms unlike laser refractive surgeries. And as mentioned before, ICL can correct a broader range of refractive error. Therefore, patients who have high refractive error that are out of range with SMILE or LASIK can also consider ICL surgery. ICL gives better night vision because the optical zone of the V4C ICL is 7.3 mm and V5 ICL is 7.6 mm, which is typically larger than SMILE that is around 6.5 to 7 mm. Since our pupils are more dilated under a dark condition, therefore a larger optical zone can contribute to improved night vision and reduce in halos and glares under low light conditions. Determining whether you are a good candidate for ICL surgery requires a comprehensive evaluation by an ophthalmologist. Generally, if you fulfill these requirements, you may consider ICL surgery. If you are over 18 years of age, not pregnant or breastfeeding, have a stable refraction for at least 1 year, and on physical examination, if your eyes are healthy with a sufficient anterior chamber depth and healthy endothelial cell count, you can consider ICL surgery. Regarding the possible adverse effects of ICL surgery, because of the design of the central port in the ICL, you may experience halos and glares, especially at low light condition during the early postoperative period. But most people are able to adapt to it within 6 months. It's important to note that while rare, complications can occur, as with any surgical procedures. These include cataract, raised intraocular pressure, and loss of endothelial cells, and the risk is estimated to be around 1%. Secondary surgeries are also rare, such as rotation of the ICL, exchange or removal of the ICL if complications arise. Therefore, it is important to have regular checkup for monitoring after your surgery. The recovery period after ICL surgery is usually short. Most people experience improved visions within a day or two, while full recovery can take up to a week or so. Most people can go back to work in a few days after the surgery. ICL surgery does not usually restrict air travel, but we recommend swimming and vigorous exercise around 2 weeks after the surgery. Your ophthalmologist will provide you with specific post-operative instructions and schedule follow-up visits to monitor your progress. In terms of regression or refractive error after ICL surgery, it is generally quite rare. The ICL is a stable and permanent solution for vision correction. And unlike laser refractive surgery, in which regression can possibly be due to corneal tissue changes and stromal remodeling, ICL surgery is not affected by corneal-related changes. However, it is important to note that a small percentage of patients may still experience some degree of regression, especially in patients with high initial refractive error and pathological myopia. Amblyopia, also known as lazy eye, is a condition in childhood in which there is an underdevelopment of the visual system due to insufficient visual stimulation. Studies have shown that some patients have visual gain after ICL surgery as the correction is closer to the nodal point. ICL surgery can improve your vision by correcting your refractive error. It does not cure amblyopia, but there can be a potential visual gain in some patients after ICL surgery. Having a history of eyelid surgery normally does not limit you from having an ICL surgery, but you might need to wait for several weeks to a month or so until your condition is stable before receiving an ICL surgery. And regarding eyelash extension, an ophthalmologist would normally recommend to have the eyelash extensions removed before ICL surgery to reduce the risk of infection. Because the cornea remains almost unchanged after ICL surgery, colored contact lens can still be used just like before ICL surgery. It can be worn after 1 month after your surgery.